3.
Okay, so we're gonna do some work on the iliopsoas muscle and on the QL, the quadratus lumboris muscle. So when the iliopsoas muscle sometimes is a little bit tight on one side, it might appear that the leg slightly inward or slightly longer, or sometimes we have this bending of the knee, that sign the tension that comes from this area. So first technique we do is tree pose, block. This is important, where to go, and then interlock, push skin back, use your foot slightly more, slightly stretch in the hip, slightly more, and then reach the lumbar area. From there we do harmonic technique. Keep pulling towards you and keep the slack, taking off the slack, and release. 1, 2, shake it. You may repeat, maybe sometime adjust a little bit if needed. Do it again, shake first and then practice. Come back, 1, 2, and shake it. This further harmonic on the iliopsoas muscle. Check it out and go directly on it. I will come from the opposite side, bend the leg, bend the leg and support so I can arrive from the top. Come inside, look the belly button, the rectus abdominis, start from the outside, sometimes I lock here. And sinking, I can use my hand either way, either like this, sometimes like this, easier, make some room for you. And then I go on the lower part because the upper part doesn't want to let me go now. And here I touch the iliopsoas muscle. In case I want to be confirming, I can ask a flexion of the leg. Going out the way we did. We go down and then only there we go inside softly and look for the iliopsoas muscle. And then you test again, both sides. Sometimes I use my fingers like this or like this to pull up the lower part or the upper part. It's really this wrist work that is crucial. And soft fingers. Then the QL. Well, almost we are in position. QL can be done with the first one leg. I would need a pillow and then get into this position, lock the back of the butt, very pushing forward with your hand. And relock if needed. This needs to be close to you, not too close. And then positioning, facing with your ara on the front. I open first and see if I can lean and open QL. I still have 2 hands, maybe to join, maybe to resist, maybe to come back. So I can slightly make some room for me, and then that's my starting position. Hands here or here to check that we are not acting, and then QL work deeply in the middle. I will have to go slowly here, maybe find an entrance door like this. And repeat the technique a few times. Try to really reach it, stretch it, or even stretch it. QL from the side, sometimes this is the only solution. Make some room for you, block and lean. Very powerful. From here. Okay? Shake it, a little twist. Please, when you do this, prefer being a little bit up when you do the steer wheel than being here. Finally, an harmonic of the QL. Almost have nothing to do for me to move. This 1 and 2. Arriving here, I would prefer the first side position. She's on the side, not collapsing. Coming from lower, taking off the slack, feeling the iliac. Nice stretch here, direction, and harmonic technique that can be done very long in case of low back pain to create an extension here and release the muscle. So we will finish 1, 2, out. Not too slow, not too quick. Go on your belly, please. We saw another technique that can concern the junction between the thorax and the lumbar and the muscle we are talking about. So we go following the ribs, and my pressure will be on the ribs, not on the spine. Here, pushing down in a circle towards the floor. And the other one, gently, will be in place first, and there's a time to lock my left upper hand, and then another one to release. No jerky movement, lock, go. This way, a few times here, 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 here. No direction like this, just pull push. Okay.